I want to bring in now Congresswoman Debbie Dingell, a Democrat of Michigan. Great to have you with us, Congresswoman. And just a few minutes ago, I hope you were able to hear your colleague, Raul Labrador, in his town hall saying that, quote, nobody dies because they don't have access to health care. Is this more about semantics? Is this, at this point, the word access to health care as opposed to the phrase affordable health care?
You know, quite frankly, I don't think any of this is semantics. I mean, people are really scared about what is going to happen. It is very clear under the bill that passed in the House, which is a very bad bill, that people who need health care the most are really worried about what's going to happen to their costs. In some ways, you talk about semantics. I say all of us have access to be able to buy a BMW, but how many of us can afford it?
Correct.
And what happened in the House this week is going to increase cost most dramatically for those who need it the most. The sick, the vulnerable, and I, by the way, don't think of a senior as somebody in their 50s, but as you get into the 50s, you're going to pay 5 times more. So what you're hearing and people out there are saying is they're scared. What's going to happen to them?
And the biggest reaction for all of this as we kind of dive deeper into this is that it really reveals a big tax cut for the wealthy. And is that the intended goal of this? Because it's really not much of a repeal, replace, or even a reform of Obamacare. It's now Trump Care, which is a big tax cut.
It's a $1 trillion tax cut to all of his friends in the cabinet and the wealthiest in our communities. And what, you know, we've even got Republican governors. I'm sitting here in Michigan. Our Republican governor has said that this is a bad plan. Healthy Michigan reduced the uninsured in Michigan by 50%. The governor is worried about what's going to happen to those people, and that's happening in states across the country. We've got to make sure that if, I'm sorry, I believe if you live in this country, you do have a right to quality, affordable health care. And he can say that nobody dies on Medicaid, but I have met person after person who doesn't go to the emergency room because, or doesn't go when they're sick until they're about to die when they end up in the emergency room, and quite frankly, some of them do.
Congresswoman, the vote was so close, with only in a few points to give House GOP members this win. Could Democrats have done something differently?
And I don't know what that means because, you know, people weren't talking to each other, which is one of the problems. Republicans wanted to get this bill through. I do think that, I've said from the beginning, Affordable Care Act's not perfect. We need to work to fix some pieces of it. Why not create a public option in many of these states? We need to do something about prescription drugs. Republicans aren't interested in fixing this bill. They're interested in, one, the $1 trillion tax cut you just talked about, and many, and I'm not saying that all, there were some Republicans that voted against the bill, and the Republicans that were uncomfortable about their vote. Their arms and legs were really broken on this vote.
But what about the Tuesday morning people and the Freedom Caucus folks of the GOP? We know that this has been tried before. Paul Ryan wasn't even able to bring it to the floor for a vote. It was canceled. What was the outreach to those concerned congresspeople of the Republican Party to talk about this and maybe not be at this position where we are now?
You know, I wasn't in those meetings. I don't want to speculate about meetings that I wasn't in. Freedom Caucus clearly had very different issues, and while I was grateful that they kept the vote from happening a month ago, I'm not going to agree with them. We have a philosophical difference. I know that many Republicans that are part of the Tuesday group are deeply bothered by what this bill would do and are praying that the Senate is going to fix it in some way, or that the bill that passed in the House will never be seen. You know what makes me the saddest about that? This isn't a game of words between two political parties. I was at 2 healthcare events yesterday, a breast cancer summit at the University of Michigan, a heart walk. There are real people that are scared to death about what this means for them.
Well, it really is, though, when we think about drilling down on the word choices that are being used by Republicans in their town halls to talk about this. And if they're describing this as a way maybe to fool people into thinking that they will have insurance because they have access to it, is wrong. And so it really is a game of being, you know, cautious about the word choices and also about being intellectually honest while we talk about this. And if we do that, you know, the Senate has the big option right now, and most of the folks over, your colleagues over on the Senate side, have said that they're going to go back to square one on this. But it's a majority of men, I think 13 men on the Senate side reviewing this. What's your reaction to that? And why isn't there a woman involved over on the Senate side at all?
Look, it deeply disturbed me. First of all, I just sort of watched in shock the picture in the Rose Garden after what happened on the house. I really wanted to cry. And when I say it's not a game yet, they are treating it like a game. But for the people that I represent and for people across the country, it's not a game. And that's the point that I was trying to make. And then when you hear, you see that picture in the Rose Garden, you realize who it is that is celebrating this, and then hear that it's the 13 white boys, sorry to say it that way, that are going to be doing this in the Senate. I get very concerned. You know, we've lost the essential services package in the House, so that people, that pregnancy is not, or delivering a baby, having maternal benefits is no longer an essential benefit. Mental health, substance abuse, these are real issues in everyday lives. And these guys don't live these kinds of issues every day. One of the reasons that I feel like I'm able and we need to have more women, we're the caregivers. We're the ones that are dealing with these issues every day in real life. Didn't ask for it, but it's our reality. And we're meeting people. We're talking to people. We understand. And you need people in a room that understand what it really means to everyday people.
Congresswoman Debbie Dingell of Michigan, great to have you on today. I thank you for your time, and I know we'll be talking about this in the near future. Thank you.
Thank you.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.